We are following breaking news right now about the Pfizer vaccine. The company that just announced a low dose of the vaccine works for children ages 5 to 11. Now it needs to be approved. The news comes after an FDA panel denied distributing Pfizer COVID-19 booster shots to everyone eligible for them. Today was the day the Biden administration planned to start rolling them out. Joining us now to sort through it all and what this means for you and your family is Dr. Frita Fisher, the founder and president of Midtown Atlanta Nephrology. Welcome to BNC and thank you for joining us.
Thank you.
So this is big breaking news about the Pfizer vaccine. Walk us through what are the next step in the process before shots can actually be distributed to children ages 5 to 11.
Najahe, this is so exciting. So we have the data that's been presented, but now all of our boards, our FDA, our CDC, we all have to sit, look through it, and absolutely be sure that the vaccinations are safe and effective. Because we often say that children are not just little adults. You don't just take a big dose and make it smaller. There's a lot more that goes into it. But if we're able to find that these vaccinations, that Pfizer is actually safe and effective in these young children, that's a game changer. Because as you know, children have gone back to school. The ones who are less than 12 have not been eligible for vaccinations. And we know that children's cases of COVID-19 have gone up 240% just in the last couple of months. And so if this is actually approved, then we can see a decrease in cases in children, and we can get that much closer to containing this pandemic.
And any idea potentially on a timeline? And then my other concern is, I think as adults, we'll often take a shot or do things that we'll do things for ourselves that we wouldn't do for our children to protect them. And so how can parents really feel confident that this is going to be okay?
Parents need to trust the process. We already see that the FDA has proven that it is an independent force in many ways, that even when the government wants to dictate certain things, the FDA takes science and evidence very seriously. And so I think that parents need to wait and see what happens after the full review of the data occurs. They also need to speak to physicians and pediatricians they trust and watch what physicians do. For me, for example, when the vaccinations were approved for children 12 and older, I took my teenager to get vaccinated. Why? Because I've been trained to do the research. I studied it very, very carefully, and it was clear to me that the risks of getting a vaccination were far less than the risks of my child getting COVID-19, the disease. So I want the parents to ask questions, ask them to the right sources, and do for yourself, which is getting the vaccination and protecting yourself, what you should also do for your children, if indeed it's shown to be safe.
Well, certainly big news on that front today. Let's shift gears now and discuss the booster shots, because today's rollout was always contingent on approval from federal health agencies. But did the Biden administration cause some confusion by announcing the plan before it was actually given the green light?
Well, I think that the Biden administration expressed what many of us scientists actually agreed with, which is that at some point, everyone will likely need a booster. We know that by the nature of many vaccinations, that over time, immunity wanes. That's why with other vaccinations that we've all gotten all of our lives, we often have to have a booster or a series. Now, in giving an exact date, September 20th, I do believe that caused some confusion, because at that point, the FDA advisory board had not had a chance to review the data. And so giving that firm date was a bit confusing. Nevertheless, now that the FDA has had, the advisory board has had a chance to review the data, we see that they are going to approve the booster for the elderly, people over the age of 65, and for people who are at risk for severe COVID-19. So what's the difference? Well, the difference is that there has been some Israeli data that shows us that even in healthy people, there is some waning of immunity, some waning of effectiveness of the vaccines. But the real issue is that the vaccinations still protect us from getting severely ill with COVID-19, and they protect us from dying from COVID-19. So just how important is it for healthy people to get the vaccination right now? That remains to be seen. I think that we still have a lot of protection. But I'm actually still excited, because beyond just the people who are at risk of getting severe COVID, I also believe that the people who are most highly exposed to COVID, such as the frontline workers, the healthcare providers, the physicians, the teachers, I would like for them to be included in that number for booster shots, especially those teachers who are with our children who are less than 12 and right now are not eligible. And so we need to watch as the story unfolds and as more and more data is presented, and the booster story is to be continued.
Yeah, and so you're mentioning Friday's decision focused on Pfizer, but why did the panel vote against booster shots for all?
Well, they voted against them for all, I believe, because we do still see that over 90% of the people who are hospitalized with COVID-19 and most of the people who die from COVID-19 are unvaccinated. So even though you may be fully vaccinated and with the waning effectiveness of the vaccines, you may test positive for COVID-19, you're still not likely to get severely ill from COVID-19 or to die. And so the thought is, why give boosters to healthy people if they're not dying and being hospitalized, but just being positively infected? Now, again, I do believe that eventually everyone will need boosters, but I just think that the data was not as compelling as we hoped it would be. We just need more time, more data, and very likely that will change. But as far as making the decision right now, they wanted to protect those who are most vulnerable, which are those over 65, those who are immunocompromised.
Well, Dr. Frita Fisher, thank you so much for continuing this discussion with us and sharing your insight here on Start Your Day.